Thank you, Mr. President, and I want to thank Senator Warner for his tremendous leadership on this important issue that is just really tormenting so many Americans right now, as well as Senator Wyden. This involves tens of millions of Americans who are facing a healthcare crisis. Their premiums are doubling or tripling, and it is completely in our hands to do something about it. Open enrollment is ending in 2 days. Americans across the country are looking at their budgets and facing this difficult choice of whether to pay double or triple for coverage or go uninsured. And why are tens of millions of Americans facing this reality? Well, because congressional Republicans failed to act, to come to the table, to negotiate an extension of the Enhanced Affordable Care Act tax credits before the end of last year. Last Thursday, the House passed legislation to extend these health care tax credits for 3 years. 17 Republicans joined Democrats. You think about it, they could have done that months ago. Months ago. We were willing to negotiate with them 3 years, 2 years, 1 year at the time. They wouldn't do anything. And now they've realized, I guess they didn't understand what was happening to their constituents when 20-some% of farmers and ranchers are on these kinds of policies and 75% of them are in red states. This legislation that Senator Warner and Wyden have proposed is simple and reasonable. We're simply saying let's make sure the same tax credits that make care more accessible for tens of millions of Americans yesterday and last year and the year before that continue to be there for families this year. Americans are looking for us to act, and the time to act is now. I've heard from people across my state in what is a very, very difficult time right now in the state of Minnesota, with the arrival of ICE on our streets, with people terrified, with the chaos that has ensued. We are still hearing from people about health care all the time. Nikki from Waseca wrote to me that the health care premium for her and her husband almost tripled from $862 a month to $2,344, which over the course of the year is more than her annual salary. She called the increase insufferable. Nadine from Sartell, a 53-year-old single mom, shared that she has a master's degree in social work but lives nearly paycheck to paycheck now because her housing and utility costs eat up over half of her monthly income. And unless Congress renews the health care tax credits, she's not going to be able to purchase health care. Of course, there's only 2 days left. And here's the kicker. Just 4 months ago, she was diagnosed with breast cancer. She's already used up nearly all she has in savings for the copays and coinsurance to get a diagnosis and receive treatment. Another constituent, a school bus driver named David, saw his premiums double. He's now spending 12% of his total pre-tax income on health insurance. David wrote that it's difficult and frustrating to see life crumble before your eyes, just trying to get ahead and just to find setbacks waiting for you. I would like Congress to actually sit in real life people's shoes for just a while to see how it feels. I hope we can get something changed. That is a bus driver in Minnesota begging our colleagues on the other side of the aisle to stand and sit in his shoes. Because if Congress can't fix this, David shared with me that even though he works full-time, he will have to give up his health insurance entirely. The rules that Senator Warner and Senator Wyden and others of us have suggested do away with the caps that limit how much of their income people like David must spend on health insurance. And so as we work to extend the health care tax credits, it's critical that we stop the administration from further undermining the Affordable Care Act and raising costs. And this just isn't happening in my state, as I know 3/4 of the people who get their health coverage on this ACA marketplace live in states that President Trump won. We know the stakes, and we must come together to solve this affordability crisis. And I will note that the amount of money given to Argentina was approximately the same amount it would take to fix this for 1 year. There's a lot more work to be done to lower health care costs. Medicare price drug negotiations that I have led for years and making sure that's really happening under this administration, reforming prior authorization, making improvements, public option, we go on and on and on. But right now, We have one crisis that is hitting so many Americans, and we have a way to fix it. So I urge my Republican colleagues to join us to stop Americans' health care premiums from skyrocketing and simply bring to the Senate floor and pass the bipartisan House-passed bill to extend the health care tax credits that Americans rely on, and of course, to vote for SJ Resolution 84, which is in front of us today, and we thank Senator Warner and Wyden for leading the effort. Thank you, Mr. President. I yield the floor.
Mr. President,
Senator Morgan.
before she leaves the floor, I just want to say that the senator from Minnesota has been relentless in terms of standing up for folks who are just trying to get a fair shake on their premiums. I've been doing this since my days with the Gray Panthers, and I know what it means to be persistent. That defines Senator Klobuchar, and I thank her. I'm pleased to be working with Senator Warner and Senator Ossoff. I see Senator Kaine here, because all of us want to make sure we lower health care costs for American families. Today, the Senate's going to vote to repeal a host of damaging policies that Donald Trump, Robert Kennedy, and Dr. Oz have unleashed on Americans who are unsuspecting. People who are just trying to get by in tough times are going to get hammered. And from the day Donald Trump was sworn in, this administration made attacking Americans' health care their top priority. Last summer, Republicans in Congress rammed through a massive bill to give tax breaks to billionaires and giant corporations while making the largest health care cuts in American history. At the same time, the Trump administration used the Byzantine federal rulemaking process to double down on these efforts by finalizing the rule that all of us on this side of the aisle are working to repeal today. The harmful changes made by the Trump administration come down to one proposition. It's okay to have more red tape, and it's just fine to increase health care costs. That's the exact opposite of our agenda, which is to focus on affordability and making the American health care system simpler. I'm going to just tick through a couple of the worst examples to illustrate why these rules need to be junked. First, the Trump rules will increase what American families have to pay out of pocket each year by nearly $1,000. So the question becomes, Mr. President, what's the purpose behind that change other than to take money from Americans who are already struggling? The rule adds new fees, such as the new re-enrollment fee that applies to low-income workers. To be clear, that means if you want to keep your health insurance, you got to pay a fee to the government just for the right to keep what you've got. Even by Washington, D.C. standards, I say to my friend from Montana, that just defies common sense. They also create mandatory minimum premiums that are going to cause millions to lose their coverage. Now, Republicans say that these fees are aimed at reducing fraud. There's just no evidence to back it up. My view has been, ever since my days with the Gray Panthers, and my friend from Virginia knows about this, I say any fraud is too much. But the numbers are clear. The vast majority of fraud in health care is conducted by shady insurance brokers who are looking to make a fast buck through commissions from phony enrollments, not working Americans looking to buy health care. So I've introduced legislation to create tough criminal penalties for these insurance brokers. So make no mistake about it, Senator Kaine, there's something we ought to be doing to root out fraud. Let's go after these insurance brokers with tough criminal penalties. I've been talking to Republicans to ask them to join as co-sponsors, and they haven't been willing really to give us the time of day. Instead of going after fraud where it exists, Donald Trump and Republicans create barriers that are going to trip up Americans trying to navigate a health care system that's just too complicated. Beyond fees and higher premiums, the Trump rule also adds new verification checks and enrollment rules that amount to an enormous heap of red tape. These red tape measures, according to authorities who've analyzed it, is going to create 15 million hours of paperwork. 1.8 million people are going to lose their coverage as they try to navigate this never land of a maze of healthcare rules. These types of changes are right out of the playbook of big insurance because they create barriers and bureaucratic hurdles so they keep more of your money while denying working families basic health care. It's no secret that Americans have had a belly full of a health care system that gets in their way at every turn. It's time for Republicans to do the right thing and join with Democrats to lower Americans' health care costs instead of creating new cost barriers and red tape restrictions. They can help those families by voting with us today. I urge my colleagues to support Senator Warner, Senator Ossoff, Senator Klobuchar, Senator Kaine. We're all here for one purpose: less bureaucracy, less red tape, lowering premiums for families. I yield the floor.
Mr. President.
Mr. President, I ask unanimous consent to be able to complete my remarks before the scheduled recess.
Without objection.
Thank you. Well, I rise today because this president is poised to strip away health care from American families again. If Congress doesn't act to pass this measure, Americans will be forced to jump through more hoops just to get health insurance, and 1.8 million Americans will lose their coverage. This is just more of the same from Republicans and the president. Donald Trump and Republicans have spent over a decade trying to repeal the Affordable Care Act entirely, with no plan to replace it. When they haven't been able to repeal it wholesale, Republicans have looked for ways to attack and weaken the Affordable Care Act from the inside out. And this is just what the administration did with this rule. They are chipping away at the Affordable Care Act and taking away health care from Wisconsin families. While President Trump works out his concept of a plan, Republicans still have no real proposal on health care. Even if they could repeal the Affordable Care Act, they have nothing to protect the 24 million Americans who got coverage on healthcare.gov from being simply kicked off their insurance. Concepts of a plan simply are not good enough for the people that I represent. They deserve better. In fact, they need some breathing room and lower costs. Instead of meeting families where they are and lowering costs, Republicans are taking us in the wrong direction. At the start of this year, 22 million Americans saw their premiums go up in 2026 because Republicans refused to extend tax breaks to help families afford their health care. And behind every one of those 22 million Americans is a story. A family forced to make impossible choices about finances, their health, and their future. I'm talking about folks like Nancy and John from Park Falls, Wisconsin, whose premiums were set to increase by over $2,000 each month in 2026. Nancy wrote to me, "This is absolutely unaffordable. Literally, we cannot pay this. We would have to sell our home and our vehicles in order to just come up with the money to do that." Another constituent from Barron County, Wisconsin, wrote to me sharing that without the tax breaks, he would have to spend over 40%, get that, 40% of his income on health insurance alone just to ensure his wife could continue to get her treatment for her breast cancer. I also heard from Eric and his wife in Menominee, Wisconsin. They both retired from teaching after 30 years and are still not yet eligible for Medicare. He wrote to me that they were seriously considering going without any health insurance since paying close to $3,000 a month on a fixed income might just break the bank. Republicans ran out the clock on helping families like these, and the final window to get coverage for this year ends in just 2 days, on January 15th. How many Americans like Eric or Nancy are being forced to give up their health insurance this year? And how many more will consider selling their houses or their car just to make sure that they can afford sometimes life-saving care? And now, on top of this, the Trump administration is pushing a rule to kick even more families off of their health care. The rule we're talking about today would shorten the open enrollment periods and introduce much more red tape, locking eligible families out of getting their health insurance. We should be making it easier, not harder, for Americans to see a doctor. We should be making health care more affordable, not more expensive. Over the past year, I've talked to countless constituents who are sick and tired of Republicans' constant attacks on their health care. Instead of spending time coming up with new ways to kick Americans off Affordable Care Act plans, I urge my Republican colleagues to help us reverse this disastrous rule and actually start working with us to fix our broken healthcare system. I yield.